I want to answer a few questions today that have come in on the YouTube channel. As I'm getting more and more busy, unfortunately, it's really difficult to scan those, so I apologize about that. So my team's kind of taking a look at them and trying to get me to answer some that might be relevant to a lot of people out there. We are in the middle of a series doing methamphetamines, and we'll be continuing those, and you'll see videos coming up on that. But today, I just want to take a little detour and answer some of these questions that my team thought would be relevant to a lot of you out there. The first question says, Dr. B, I would really appreciate your professional medical opinion on something. I've been on 1 milligram a day of Suboxone, split into 4 doses for months now, never taken more than that. Would it be okay for me to drink a couple of beers on this dose? I feel very little effect on Suboxone, more so holds off the full withdrawals for me, but it's almost bare minimum. Thank you for your video and support for people in recovery. Have a blessed day. So this is a good question, and it comes up often. So I think it would be relevant for a lot of people to gain insight into this. Now, I don't know this person or this client or this patient, but I can give you a general answer. And I think to put this question in a more formal, general approach is, can I mix alcohol with Suboxone products or buprenorphine products? In general, mixing an opiate or a partial opiate with alcohol, it's it's not recommended. And most people in this case wouldn't feel it or have any additional impact from it. But I will say this, it's sort of difficult to advocate the use of any substances that are mind altering for this community. So I have a lot of clients on Suboxone, and when the issue of alcohol does come up, I always ask them to refrain from alcohol. Pharmacologically, if that's the question, there can be potential additive effects with a sedative hypnotic, which is the class of medications that alcohol falls under, and buprenorphine or Suboxone products, which falls under the opiate class of medications. And even that has a little caveat to it, because it certainly is not like doing heroin and drinking alcohol. Most of the people on this medication aren't going to have any euphoria or higher cognitive effect from it. Nevertheless, I generally ask all my patients to refrain from alcohol and also the marijuana out there, which is a topic we'll get to in the next couple of months, hopefully, out here. And that's my answer for that. It's not going to directly probably affect you, but that's all things being equal. I don't know anything about the patient that has asked this, and I would ask in general that everyone refrains from mixing alcohol with these medications. The next question that I'd like to answer, I'm going to kind of break it down here into multiple parts. And the viewer asked about Orlam, which I won't address here, but they ask a few questions that are really, really important questions that I think a lot of you have out there. What are the benefits of switching from Methadone to Suboxone? That's a great question, and it's an area where what we call best practices, backed up by clinical evidence, has not really been hashed out yet. But if you have clinical experience with prescribing both medications, and you are seeing what's happening out there and your own personal patients, this can really be a benefit to you. Number one, I think methadone is still listed as first-line treatment for opiate use disorder, and I think buprenorphine products have now been added to that. But you have to kind of look at the social environment where these medications are handed out. If you just simply think about the logistics of it, being on methadone has, as they used to say, liquid handcuffs. And where that term comes about from is the fact that methadone is usually handed out in liquid form. And it's a handcuff because you have to go to the clinic every morning. In addition, it's very early morning. And the way that came about is, if you go back some years, many years in fact, on the East Coast, when methadone started to become sort of fashionable, and that's not the right term, but rather in use and first line treatment for heroin addiction, these clinics in Jersey, New York were open very early in the morning because it was the blue collar class that was usually afflicted and affected by this issue. And so most of these guys had to be at work very early. And so the whole idea of a federally controlled clinic that was handing out methadone was so that it is accessible to this population. And from there started these early morning methadone clinic openings and closing, and that has never been addressed. So number one, the logistics of it, for the most part, you have to get up early in the morning. And number two, you have to do it every morning. And number three, you have to go somewhere to get your medication. We've come a long way since that time because now some of the clinics, there's tiered programming. It, again, depends on the state you live in. And there's federal guidelines and state-specific guidelines and potentially county guidelines where you can have take-home doses and you graduate up to that, from daily to weekly to monthly and so on. So that's a little bit better. But besides that, again, you have to wake up every morning very early. You have to go somewhere to get your dose. Those are some of the logistical issues that right there kind of makes it so, hey, I want to switch to Suboxone. Keep in mind, some places, some counties, if you're getting your Suboxone under the county insurance, you still have to go in every morning and get your Suboxone from the methadone clinic. This itself, in contrast, for example, to France, people get their methadone for opiate use disorder from a doctor's office, just like they get their Suboxone products from a doctor's office. Just some differences for you to think about. And out there, let's just take France, for example. They've had tremendous amount of success disseminating methadone and Suboxone since the 90s from a doctor's office. The next issue is the medication itself and the logistics of it. There's also the issue of cost, but we're not going to address that here in this video. Methadone is it's nice to think of it as a much heavier drug than Suboxone. Okay, takes a little bit of skill to titrate, and then you get it up to a certain dose, and then it takes quite a while to titrate down, and there's nuances and time involved here. Suboxone is much easier to initiate, and also you don't have to worry about transferring issues. Methadone to transfer to Suboxone itself is a complicated task. So that's another reason that being on methadone versus Suboxone is just so much easier to manage the medication of Suboxone. And where that comes from, when you look at the pharmacology of the medication, methadone at high doses has certain side effects, one of them being with your heart. It's called torsade de pointe, and that's, again, life-threatening arrhythmia that can occur at certain doses. Two, although methadone is long-acting and it lends itself to the fact that it makes it great medication for medication-assisted treatment or replacement therapy, it's a full agonist. So given at a high enough dose, you can overdose, and mixing it with other drugs like benzodiazepines, you can get a good high off of it. In fact, what I notice out there on the streets nowadays, and I do work, I'm a medical director of a methadone clinic in Hollywood right now. One of the things you start to see, and this has been going on for years, and it started with the influx of the tar heroin from Mexico. A lot of people are potentially underdose off the methadone. So there's a routine a lot of guys out there have. You go to the clinic, get your methadone, and then throughout the day, you pick up your $20 bag or $15 bag of heroin, black tar, and then that supplements you throughout the day. In addition, in the 70s on the East Coast, you'll see a lot of addicts really discovered the potency of the euphoria of mixing benzodiazepines or barbiturates with their methadone. All of these problems, if prescribed appropriately, are mitigated by the use of Suboxone type products. In fact, I would argue, and I won't get into it here, methadone dosing at the right dose, if prescribed correctly, would mitigate a lot of these issues. So in short, without getting into too much details, the chemical structure and the pharmacology and the dosing of methadone is a lot more complex. There's a potential to overdose, and there's a potential for getting high off of this medication. So all of those make it a lot more ideal to transfer from methadone to Suboxone. I will add one more thing that's another issue. Who is appropriate for methadone and who is appropriate for Suboxone? We don't have really best practice validated data that tells me that information. I do have clinical experience, and you see what's going on out there. In general, I would advise people nowadays, and you don't hear this, but I have to be honest about it, is first start off on Suboxone, and if that's not working, there is a segment of the population that need to be on methadone, and that drug works for them. I don't have anything against methadone. Like I said, I'm a medical director of a methadone clinic, and there's a certain segment of the population that this works out for, especially what I call the old timers. This is working out for them. And I'll leave it at that, except to say there's those benefits that I just described regarding transferring from methadone to Suboxone. Finally, on this issue, keep in mind that transfer is a little bit tricky because you have to get under about 30 milligrams of methadone and then make that transfer. And sometimes it takes a few days versus some of the stuff like heroin and pills. You can do it much more quick than that. Thank you very much. If you enjoyed those videos, go ahead and click above to my right for other related videos. And please, please don't forget to subscribe to our channel and press the ring button. And please continue to watch as our methamphetamine series is continuing at this time.